Thank you very much, Presiding Officer. As ever, the SNP present a sleight-of-hand budget where their cuts are magically spun as generous settlements, particularly if you're in local government, but otherwise it's always somebody else's fault. Welcome to the SNP's Alice in Wonderland approach to budget setting. Now, SNP members are keen to tell us that there is a fixed budget. But of course there are fiscal levers the government can pull. Income tax, land and building transaction tax. Goodness, they can even reform the council tax promised in 2007 but never delivered. But what people are seeing is their taxes going up but services being cut at the same time. Now, the budget is about setting out priorities. Where are the measures for growing the economy on which our future tax take will rely? Where are the measures for tackling the cost of living crisis, for investing in our public services? Now, the National Performance Framework sets out what the government believes are the priorities, but it's interesting that there's no link with the budget. Spending over £45 billion in revenue, but not linking it to the delivery of your priorities is frankly absurd and out of step with almost every other OECD country. Now, let me start with local government. £1 billion is what COSLA said they needed to cope with the cost pressures for the year ahead. Instead, the unring-fenced money they got amounted to about £32 million. Mark Griffin was absolutely right to point out that funding for new commitments doesn't actually help with core budgets. The consequence of this is libraries closing, teacher numbers being reduced, funding to repair our roads slashed, and deep cuts across every local service. And according to a leaked report from COSLA, almost 7,000 staff could lose their jobs. A centralising government that has decided to simply sacrifice local democracy and services, criticised by their own SNP councillors, but this government is deaf to their concerns. Let me move on to health and social care, inextricably linked and must be equally valued. The Royal College of Nurses tells us that they want to see fair pay for nursing staff in the budget, a focus on retention and reversing the growing number of vacancies, which is having an impact on patient safety. And we agree. But you could substitute the word social care worker in place of nurses, and the same applies. The poor pay leading to many of them leaving their jobs and taking jobs in retail and hospitality because they get more money there and less responsibility, and the increasing number of vacancies and the challenge to ensure the safety of those cared for. Now, the crisis in health and social care cannot be resolved without addressing the scandal of low pay in social care itself. But this budget offers little. The 40p pay uplift is an insult to staff. A social care worker is comparable to a Band 3 nurse. Social care workers got 3.8%. Nurses got double that. The Scottish Women's Budget Group were also very clear that care workers' wages should be set at £12.50 in the short term, rising to £15 per hour, a move that Scottish Labour have repeatedly called for over 3 successive budgets. The Coalition of Care and Support Providers also makes the point that more money for social care workers, a predominantly low-paid female workforce, is more spent in the local economy. But of course, the Deputy First Minister stripped £50 million away from the Fair Work budget in his emergency budget, so he's shown where the SNP's priorities lie. The cost of increasing adult social care pay is £150 million. This has been verified by Spice. Daniel Johnson set out several budget lines from which this could be drawn, more than was actually required to meet the policy. Take it from the National Care Service. Take it from delayed discharge. I have to actually say it is a bit rich for Ross Greer to falsely claim that we were moving money out of the health and social care budget. And can I remind him, it was, after all, the Greens who promised £15 an hour to social care workers before the election in the manifesto, but sold out for ministerial Mondeos instead. Now, the Deputy First Minister knows my view of the current framework bill for the National Care Service. Instead of a vision and approach that delivers cultural change, we have expensive structural change that doesn't invest one single penny extra in a care package. It's nothing more than a national commissioning service, with no answers about what happens to the pensions of the 70,000 public sector workers who will be transferred in, or indeed the potential to have an additional 20% VAT cost imposed on a centralised service. COSLA are unhappy. Trade unions are unhappy. The third sector, the voluntary sector, are unhappy. Those with lived experience are beginning to understand that this is the emperor's new clothes. Pause the bill and listen to what the sector are telling you. Use the money released to fund social care. We all acknowledge that we're living through one of the worst cost of living crises in a generation. And at a stroke, the SNP could end non-residential care charges. At a cost of £68 million, this would help sustain older people and vulnerable people, those with disabilities, in their local communities. It's in your manifesto. You can do it now, and you can help some of the most vulnerable people in Scotland. Presiding Officer, after 15 years of the SNP, their cuts to training places for nurses, their cuts to primary care, their reduction in the number of whole-time equivalent GPs, the cut of £1 billion by Nicola Sturgeon when she was Health Minister, all of this has contributed to the crisis in health and social care. Scotland cannot afford to pay the price of SNP mistakes any longer. Vote against the budget.